guys, welcome back. I hope you are all doing well. I am so sorry that I did not come back sooner to make another video for you guys, but like I talked about in the previous intro video of mental health, I will be covering this content, and a lot of you were interested and wanted me to make more videos, so that's what I will be doing. And it all worked out because May is actually Mental Health Awareness Month. So this is the perfect time to talk more about this topic and to spread more awareness. So the topic I will be covering today is eating disorders. These conditions affect both your physical and mental health, and they include focusing too much on your weight, your body shape, or food, and this can lead to very dangerous eating behaviors. And these behaviors can seriously affect somebody's ability to get enough nutrients for their body. Eating disorders can cause harm to the heart, the digestive system, bones, teeth, and mouth, and they can lead to other very serious diseases. They are linked with other mental health disorders such as depression, anxiety, self-harm, and suicidal thoughts or behaviors. So if these eating disorders are not treated effectively, it can lead to a lot of long-term problems and, in some cases, death. And the most common eating disorders are anorexia, bulimia, and binge eating disorder, but there is a little bit more different kinds. So the first one I will be covering today is anorexia. I feel like this is the one that most people know about. It includes an unhealthy low body weight, an intense fear of gaining weight, and a view of weight and shape that is not realistic. Anorexia often involves using extreme measures to control your weight and your shape, such as limiting calories or cutting out certain food items or food groups, exercising too much, overusing laxatives and diet aids, and vomiting after you eat. The second type of eating disorder is bulimia. This includes episodes of binging, which means eating a lot, and then followed by episodes of purging, which is a way of trying to get rid of everything that you ate and all the calories. Sometimes bulimia can include severely limiting the amount of food that you eat, and this leads to bigger and stronger urges to eat a lot and then purge. So binging includes eating an extremely large amount of food in a short amount of time. And during binging, people feel like they have no control over what they're eating and they just cannot stop. And after eating, due to guilt or shame or just an intense fear of gaining too much weight, they will purge. And this is done to get rid of calories. So purging can include vomiting, exercising too much, not eating for a long period, and then using other methods such as taking laxatives. Additionally, some people use medicine doses such as changing the insulin amounts to try to lose weight. Another eating disorder type is binge eating disorder, and this just includes eating a lot of food in a short amount of time. And during a binge, people eat food faster or eat more food than planned, even when they're not hungry. And eating may continue long past fullness. So they're extremely full, but they will continue to eat. So I actually have a story of when I was working at the facility. One of the patients was telling me about when she's at home, she would get up in the middle of the night, and she would go to her kitchen and she would eat an insane amount of food, like boxes of cereal, lots of bread, just anything that was in the fridge or in the pantry. And then whenever she would wake up, she would not remember. So there's different kinds of extreme cases that are seen. The last type of eating disorder I will be talking about is ARFID, which is avoidant restrictive food intake disorder. This is also sometimes considered as picky eating, but this is a lot more extreme than just being a picky eater. This includes extremely limiting eating or not eating certain foods. And people with this disorder don't have any fears about gaining weight or body size. It's not about how they look on the outside or their weight. Instead, they may not be interested in eating or avoid certain foods because of the color, the texture, or the smell. And then they could also worry about what happened when eating certain foods. For example, we had a patient that was scared of eating certain like crunchy or hard foods because they were scared of choking or vomiting. They could also worry about getting stomach problems. So other issues other than just the calories or the weight or how they appear is what is causing them to have these eating behaviors. So this pattern of eating often does not meet the minimum amount of daily nutrients that a person needs, and it can lead to problems with growth and can lead to different development and functioning problems in daily life. So next, I will be talking about different red flags that could suggest an eating disorder. So this includes skipping meals or snacks or making excuses for not eating, having a very limited diet that has not been prescribed by a trained medical professional like a doctor or a dietitian, too much focus on food or healthy eating, especially if it means not participating in usual events such as sports, banquets, birthday parties, or going out for dinner. Making own meals rather than eating with the family, withdrawing from social activities, frequent and ongoing worry or complaints about being unhealthy or overweight, and talk about losing weight, frequent checking in the mirror for what are thought to be flaws, repeatedly eating large amounts of foods, using dietary supplements like laxative or herbal products for weight loss, and then exercising much more than an average person. This includes not taking rest days or days off for injury or illness, or refusing to attend social events or other life events because of wanting to exercise. Calluses on the knuckles from reaching their fingers into their mouth to cause vomiting. So you'll see maybe some calluses or wounds right here. Problems with loss of tooth enamel, that can be a sign of repeated vomiting. Leaving during meals or right after a meal to use the toilet. Talk of depression, disgust, shame, guilt about eating habits, and then eating in secret. These are just some risk factors that could give you a hint about somebody who might be struggling. And although anybody can develop an eating disorder, certain factors may increase the risk of developing an eating disorder, such as family history, other mental health issues, dieting and starvation, a history of weight, bullying, and stress. So for family history, eating disorders are more likely to occur in people who have parents or siblings who have an eating disorder. Trauma, anxiety, depression, obsessive compulsive disorder, and other mental health issues can increase the likelihood of an eating disorder. Frequent dieting is a risk factor for an eating disorder, especially with the weight that is constantly going up and down when getting on and off diets. And there is strong evidence that many symptoms of eating disorders are symptoms of starvation. Starvation affects the brain and can lead to mood changes, rigid thinking, anxiety, and reduced appetite. This may cause severely limiting eating or problem eating behaviors to continue and make it difficult to return to healthy eating habits. People who have been teased or bullied for their weight are more likely to develop problems with eating and eating disorders. This includes people who have been made to feel ashamed by their peers, healthcare professionals, coaches, teachers, or family members about their weight or how they look. And then whether it's heading off to college, moving, landing a new job, or a family or relationship issue, change, any type of change that can bring stress can increase the risk of an eating disorder. So next, I will be talking about prevention of eating disorders. There's no way to for sure prevent eating disorders, but there are ways to develop healthy eating habits. So for adults, choosing a healthy diet which is rich in whole grains, fruits, and veggies, limiting salt, sugar, alcohol, saturated fats, and trans fat, avoiding extreme dieting, and if you need to lose weight, talking to your healthcare provider or dietitian to create a plan for your needs. Do not use dietary supplements such as laxatives or herbal products for weight loss. Make sure you get enough physical activity each week. Get about a total of 150 minutes of aerobic activity, such as brisk walking. Choose activities that you enjoy so that you're more likely to do them. And lastly, you want to seek help for mental health issues such as depression, anxiety, or issues with self-image or body image. Some ways that you can help your child develop healthy eating habits is by avoiding dieting around your child. Family dining habits may influence the relationship children develop with food, and eating meals together gives you an opportunity to teach your child about the pitfalls of dieting. It also allows you to see whether your child is eating enough food and has enough variety. There are many websites or social media sites that can promote dangerous ideas, such as viewing anorexia as a lifestyle choice rather than an eating disorder. Some sites can encourage teens to start dieting, and it is important to correct any wrong ideas like this and to talk to your child about risk of making unhealthy eating choices. You want to encourage and reinforce a healthy body image in your child, whatever their size or shape. Talk to your child about self-image and offer reassurance that body shapes can vary. Don't criticize your own body in front of your child. And messages of acceptance and respect can help build healthy self-esteem. This can also help them build resilience, the ability to quickly recover from difficult events, and these skills can help your child get through challenging times of teen and young adult years. Lastly, you want to ask your child's healthcare provider for help. At well child visits, healthcare providers may be able to identify early signs of an eating disorder. They can ask the child questions about their eating habits, and these visits can include checking the weight, the height, the percentiles, and body mass index, which can alert you and your child's provider to any big changes. So all these tips can help in developing healthy eating habits for both adults and children. That is all I have for you guys today. I hope you really enjoyed this video. Please let me know what you would like me to talk about next. I am hoping to make a couple more videos on mental health. Don't forget to subscribe, like this video, and to turn on the post notification button so you are notified whenever I come back to make another video. Thank you so much.